Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey everybody, I'm Dr. Circolone. I'm so excited to be here. Listen, last week we talked about disc problems and facet syndrome, and I promised you I was going to give you some exercises to help with some of that facet pain. And today we're going to talk a little bit more about that. A little recap. What is a facet? Well, the facets, I have my spine on the stick here. Our facets are located right here. This is the bony part which articulates with the vertebra below and the vertebra above. Now this is where a lot of pain occurs. And the exercises we're going to be doing today are going to show you how to decrease that tension in there, decrease that pain in there, and allow you to function normally and have a more productive and more healthy lifestyle. First, I want to say, if you have low back pain and you've not seen somebody about it, you need to see someone before you start these exercises. If any of these exercises hurt, then stop doing them. Now, we call them exercises, but they're mostly stretches. What we're going to do is we're only going to do several of them. They're going to be very easy to do, and I'll mention this in the exercise area as well, but I want to make sure that you find a soft surface where it's comfortable, because at points you're going to be on your knees, and I don't want you causing any pain and any discomfort in your knees. If you have knee problems, I'm showing you an alternate move that you can do that'll help decrease some of that. I'm giving you one exercise, and I mentioned it in the next part of this video, called dysfunctional breathing. Now, a lot of people have dysfunctional breathing. Why? They breathe through their chest. Well, that's not the way we need to be breathing. We need to be breathing from our bellies. If you've ever watched a newborn, they breathe from their bellies. So I'm going to be laying down doing this, but put your hand on your belly and your hand on your chest. If your chest moves up and your hand moves up, that's not what we want. We want your belly to move out and your hand to move like this. So without further ado, let's get into it. We're in the gym. I'm going to get started with these exercises. Now, the first thing we're going to talk about, and it's called dysfunctional breathing. I guarantee you won't even break a sweat doing this. Okay, so the first thing we're going to do is we're going to lay on our backs. Just get comfortable, legs up, and you're going to breathe from your belly. Deep breath in. Let it out. The reason why we call this dysfunctional breathing is because most people breathe from their chest, and that's not helping your diaphragm. Now, the next exercise we're going to do is a bridge. Okay, we're going to put your feet, plant them tightly like this. You're going to lift up and just hold it. And hold it for about 5 seconds. If this hurts, don't do it. The next one we're going to do is we're just going to bring your knee to your chest. You're going to hold it there. Don't force it. Just gently hold it. Now, if you have knee problems, just grab below the knee and pull back. This protects the knee joint when you do it like this. And hold it for about 5 to 10 seconds and then let it relax. Now, whatever you do for the right side, you want to do for the left side. The next one I call a figure 4. You're just going to bring the leg over this way, drop it down, and push. Now, you may be tight in this area. You're going to have the iliopsoas that gets tight. You're going to have the hamstrings that get tight. You're going to have the quadriceps that get tight. You're just going to gently push. Don't force it. If it hurts, again, don't do it. And just push it gently. Bring it back slowly. Put it back down. Again, do the opposite side. If you have hip issues, if you have irritation in the joint, be careful when you do this. The next few exercises we're going to sit up for. They were pretty easy, weren't they? Not so hard, easy to do. So the next one, we're going to get on our hands and knees. Now, a lot of people have a hard time if they have bad knees that they can't get on their knees. You can do this on a soft surface like I'm doing here. You can do it on a bed. Anywhere where it gives you a little stability and a little firmness, but it doesn't have to necessarily be a floor to do this on. So we want to get on our hands and knees first, and you're going to be in this position here. Now remember what we talked about, dysfunctional breathing. We want to use that dysfunctional breathing, breathing from our bellies. So we're going to breathe in, and we're going to lift our neck up and extend our back. And we're going to blow out and push like a cat. So we call this cat-cow. Now, we'll tell you this. A lot of people have a hard time extending in this position. If this hurts, we don't want to do this. We want to work on it slowly. So we'll stay in a neutral position, and we'll just do the cat stretch. Now the next and the final one that I want to do is called child's pose. Okay, so what we want to do is we just want to stretch back. Get that stretched out. You want to open that back up. Just open it. Now this right here feels wonderful. This is a good exercise just to open up those back joints. And then from here, come back up and breathe in, breathe out, breathe in, breathe out. And come into neutral spine and pull back. Now I really like to do these together. I get in my cat-cow position, and I do a few of those, and then I lay back into my child's pose. Now, what happens when you do these exercises, some of them are going to hurt. Some of them are going to cause a little bit of discomfort. If they cause too much discomfort, you just want to stop. What's going to happen is you're going to notice that the more you do them, the better you're going to feel, and the easier they're going to get. What I want you to do is take these, do them slowly, do them methodically, do them religiously every day. Now, some people ask, Doc, how many times a day do I need to do this? I suggest at least twice, once in the morning and once at night. And what will happen is, once you start doing these, you'll notice that number one, your flexibility is improved, and number two, your pain starts to go away. If you have back problems or facet syndrome, you're going to need to do these exercises daily. Again, if any of this hurts, don't do them. If you feel that you can't do them, we'll look at some other exercises that you can do. But the most important thing is that you want to talk to your doctor before you start any exercise program. Well, guys, it's been a great show. I love you guys. God bless, and we'll see you next week.